Breast cancer is a cancer that starts in breast tissue. It happens when cells in the breast change and grow out of control. The cells usually form a tumor. Sometimes the cancer does not spread any further. This is called in situ. If the cancer spreads outside the breast, the cancer is called invasive. It may just spread to nearby tissues and lymph nodes. Or the cancer may metastasize, spread to other parts of the body, through the lymph system or the blood. Breast cancer is the second most common type of cancer in women in the United States. Rarely, it can also affect men.
There are different types of breast cancer. The types are based on which breast cells turn into cancer. The types include ductal carcinoma, which begins in the cells of the ducts. This is the most common type. Lobular carcinoma, which begins in the lobules. It is more often found in both breasts than other types of breast cancer. Inflammatory breast cancer, in which cancer cells block lymph vessels in the skin of the breast. The breast becomes warm, red, and swollen. This is a rare type. Paget's disease of the breast, which is a cancer involving the skin of the nipple. It usually also affects the darker skin around the nipple. It is also rare.
Breast cancer happens when there are changes in the genetic material, DNA. Often, the exact cause of these genetic changes are inherited, meaning that you are born with them. Breast cancer that is caused by inherited genetic changes is called hereditary breast cancer. There are also certain genetic changes that can raise your risk of breast cancer, including changes called BRCA1 and BRCA2. These two changes also raise your risk of ovarian and other cancers. Besides genetics, your lifestyle and the environment can affect your risk of breast cancer.
The factors which raise your risk of breast cancer include older age, history of breast cancer or benign, non-cancer, breast disease, inherited risk of breast cancer, including having BRCA1 and BRCA2 gene changes, dense breast tissue, a reproductive history that leads to more exposure to the estrogen hormone, including menstruating at an early age, being at an older age when you first gave birth or never having given birth, starting menopause at a later age, taking hormone therapy for symptoms of menopause, radiation therapy to the breast or chest, obesity, and drinking alcohol.
The signs and symptoms of breast cancer include a new lump or thickening in or near the breast or in the armpit, a change in the size or shape of the breast, a dimple or puckering in the skin of the breast. It may look like the skin of an orange. A nipple turned inward into the breast. Nipple discharge other than breast milk. The discharge might happen suddenly, be bloody, or happen in only one breast. Scaly, red, or swollen skin in the nipple area or the breast, or pain in any area of the breast.
Your healthcare provider may use many tools to diagnose breast cancer and figure out which type you have. A physical exam and medical history, imaging tests, breast biopsy, blood chemistry tests. If these tests show that you have breast cancer, you will have tests which study the cancer cells. These tests help your provider decide which treatment would be best for you. The tests may include genetic tests, HER2 test, and an estrogen and progesterone receptor test. Another step is staging the cancer. Staging involves doing tests to find out whether the cancer has spread within the breast or to other parts of the body. The tests may include other diagnostic imaging tests and a sentinel lymph node biopsy. This biopsy is done to see whether the cancer has spread to the lymph nodes.
Treatments for breast cancer include surgeries such as a mastectomy, which removes the whole breast, a lumpectomy to remove the cancer and some normal tissue around it, but not the breast itself, radiation therapy, chemotherapy, hormone therapy, targeted therapy, and/or immunotherapy.
You may be able to help prevent breast cancer by making healthy lifestyle changes such as staying at a healthy weight, limiting alcohol use, getting enough exercise, limiting your exposure to estrogen by breastfeeding your babies if you can, limiting hormone therapy. If you are at high risk, your healthcare provider may suggest that you take certain medicines to lower the risk. Some women at very high risk may decide to get a mastectomy of their healthy breasts to prevent breast cancer. It's also important to get regular mammograms. They may be able to identify breast cancer in the early stages when it is easier to treat.